Okay, so I am here with Lisa Lachance, MPA, PhD candidate. They are Managing Director of Solutions for Kids in Pain, and also President of Wisdom to Action Limited. And those URLs, if you're curious, are kidsinpain.ca and wisdom, the number 2, so numeral, like wisdom to action. Well, Joanne will get on it. They are also currently a doctoral candidate in health at Dalhousie University, focusing on the potential of collaboration between mental health services and the youth serving nonprofit sector to improve youth mental health. Their PhD will add to their other degrees in public administration and international development studies. Lisa's professional experience includes time working for the Canadian International Development Agency, CIDA, and a stint as Director of Policy at the Nova Scotia Department of Finance. So we have a very broad background to benefit from today. We really appreciate it. So Lisa's presentation today is about the power of engagement, community-based organizations, and knowledge mobilization. Ms. Lachance, are you ready to start?
I am, thank you.
Sure.
Great. Well, thanks so much for that introduction. And I honestly think John's presentation couldn't have been more perfect in terms of perhaps setting up some of the thinking around our work with Wisdom to Action. So I'm hoping people will see some of the themes as we go through the presentation come to light. I'm going to share the Wisdom to Action story with you today. I'm hoping that it'll draw upon a lot of the conversations about engaging youth and engaging communities and multi-directional methods of knowledge translation that started with John's presentation. So I'll give you a sense of our original structure. So we were funded and founded by the Networks of Centers of Excellence, which is a Government of Canada funding organization, through their knowledge mobilization program in 2011. And over the first 4 years and then a renewal, we had funding of 2.8 million Canadian over 7 years. And our mandate was to support the mental health and well-being of children and youth in challenging contexts. And we took some time to think about what that means, because obviously that's a pretty broad mandate, and how could we make a difference, and where do we need to focus, and where were some of the knowledge needs in terms of supporting young people, and particularly marginalized young people and young people in vulnerable communities. So we developed our mission to focus on the youth serving sector, and you see it there in front of you. And over time, we built a network of over 250 members from every province and territory in Canada. And I also saw in the chat that we have a lot of Canadians online today, so that's great. And we also have dozens of international members as well. And we built ourselves as a cross-sectoral and interdisciplinary network. So it included researchers, community-based service providers, educators, healthcare professionals, and youth. So I just wanted to start to help ground our discussion in why we felt focusing on the youth serving sector when thinking about youth mental health was really important. So this is a photo from an Inuit youth land and culture camp that my son attended a couple of years ago in the Northwest Territories. And this was the program tent where, I always say all the magic happened. So, activities like making sealskin mitts, getting ready to go out and fish or snare, as well as having, presentations from service providers on sexual health, climate change, and food insecurity in the North. And this was clearly a transformative experience for my son and for the young people that he was with. So here's a program that clearly contributed to individual as well as collective mental health, but yet, was not part of the mental health treatment plan that we had ongoing for him here in Halifax. So while, of course, the mental health professionals that we saw were pleased that this was happening, it wasn't planned for, it hadn't been identified as part of perhaps what he needed. And in terms of follow-up, again, it was, politely acknowledged, but wasn't part of the ongoing treatment and planning. And yet, we do have growing evidence around the value of land-based programming for Indigenous young people. For instance, we know that this stuff is important. We know these types of programs help young people build their well-being and their resilience. And we really wanted to see about how the community-based service providers who are doing this type of work can better connect with the mental health system. So this picture helps me ground in that type of perspective. So our knowledge mobilization approach, so we had to look at a number of the different types of KT and KMB frameworks. And I should say knowledge mobilization is a particularly Canadian term, I think. But when I say knowledge mobilization, I'm mostly referring synonymously with knowledge translation. And we chose the promoting action on research and health services model for a couple of reasons. One is that it seemed like one that was pretty easy or easier to explain to community service providers, for instance, in terms of having three main components: gathering the evidence, contextualizing the evidence, and then facilitating the uptake of best and promising practices. And we also could see how our work as a knowledge mobilization network would fit into those three categories. And we really started with a perspective that we valued the research, and we also valued the practice-based evidence, and wanted to strengthen the evidence base of practice through evaluation, evidence, and engagement. We've used participatory and youth engagement methods, and really been grounded in principles of anti-oppression, equity, and positive youth development. So looking at some of the barriers and facilitators to knowledge mobilization in the community-based sector will perhaps help explain how we built and developed our different projects. So in terms of barriers, so staff time and available resources are a huge barrier. As you know, in the community-based sector, people are responding to the needs of the clients that are coming in the door, or connecting with them other ways. And at the same time, funding is both limited for the actual programs, and then often has very little, it allows for very little capacity building or knowledge translation in and of itself. It's often very project-based and doesn't add to sort of an operational capacity. Staff often, we don't have the capacity to access evidence, and if they do, it's perhaps first of all, you can't access journals if you're not aligned with the university, and then being able to take the evidence that they might find and understand how it might fit in their own context or in their own organization is challenging. Evidence-based practices are not often considered relevant. They're often focused on one issue. They're not based in a particular context. They don't necessarily have the ability to be tested in different contexts, and the lack of learning networks. And so, I mean, all this is obviously interrelated, but if you don't have funding that provides for the building of learning networks, then it's very hard to establish them. But obviously there are some core facilitators. So one is a deep understanding of the youth, and I should probably add their context and community, and and a passion and dedication to doing better and to improving the mental health and well-being of young people. So I'll talk through a bit about how we approach these three categories that we use, guided by the Paris framework. So first is gathering the evidence. So we produce a number of knowledge synthesis reports, and while this is a fairly common KT tool for a lot of researchers, I think the way in which we developed these was quite unique. So first of all, the questions were actually generated by our network. So we did the first three through sort of a Delphi process, and then the next four built from that. So these were questions coming from community-based service providers, as well as youth and researchers who were part of our network. And then each knowledge synthesis report was developed by a researcher, by a community-based service provider, and by a young person as well. In our network, we worked hard to connect with young people who were multiple service users who had lived experience of the types of services. So maybe not the sort of typical youth might be engaged, and certainly not sort of typical young people who might become research assistants and that sort of thing. And so together we provide staff support for those usually three authors to develop the report. And when I first joined the network, actually the first 3 were done. They were all over 100 pages. And from being involved in a lot of nonprofit organizations and also from working in government, I looked at this and thought, no one's going to read this. This is so important information, but 100 pages is not what government policy folks tend to read, and it's also not what community service providers are able to read. And so we developed summary documents, and then we also developed policy checklists. So people could literally sort of pick up this policy checklist, which ran 2 pages for each report, and trust that it was based on good, solid evidence, and be able to guide their thinking about programming and structure based on those checklists. And we also met with a roundtable of community service providers here in Halifax for the last 4 reports, 4 times in the development of them. So we met to confirm the questions, we met with initial findings, we presented the draft report to the group, and then finally we did talk about their KT needs. We also did youth workshops with every report to test the findings that were coming forward, and developed a number of videos. And so we really tried to take a basic sort of knowledge synthesis approach, and then really add to it. And I should say too that in our knowledge synthesis, we looked at research evidence, but also program evidence. So we did do a lot of searching in the gray literature to develop these as well. We had a number of knowledge mobilization innovation grants. So firstly, I should say that the project team that developed these included staff, researchers, but also youth, who helped develop the criteria for the microgrants, and they really reflected the W2A principles such as youth engagement. And these were designed to be small grants, so these were about $7,000 Canadian, to support projects that either was an organization to share a promising practice, or for researchers who had obviously really done already their research, but had something that they wanted to share or deepen their community connection. And then we also want, in all of that we were learning about how to do community-based knowledge mobilization, we really wanted to make sure that we were also engaging graduate students in our work. So we wanted to make sure that the next generation of researchers was learning along with us about how to do community-based knowledge mobilization. And so in this case, we added an honoraria to support graduate student in evaluation. And I don't have time to go through all of the projects that we funded. We funded about 15. And I would say that drawing on some of John's presentation, so there were a number of videos that were made. We supported a project in Inutsiavut with a researcher who had done a lot of work around sort of cultural learnings being passed from elders to young people. And one of the things that they really wanted was to develop some books, so that particularly some of the elders would be able to have photos of their time together and that sort of stuff for their own use. So we did some of that work. We worked with an organization in Ontario called Mind Your Mind, and they facilitated a zine workshop of youth to actually reflect on one of our knowledge mobilization, our knowledge synthesis reports. And they all produced zines looking at the issue of technology and mental health. And then the graduate student who did the evaluation actually presented the evaluation in graphic novel format. So that just gives you a flavor of some of the things that organizations did. And really, I think one of the other things that struck me was that micro grant, and was very much a very micro grant, actually really seemed to provide for some transformative change for organizations and for researchers. Like it was sort of just enough to really provide support for something new. So then we also thought a lot about, so then how do you contextualize the knowledge? So even though an example would be our knowledge synthesis report. So that's great. Like we did lots and lots of things and provided them in lots of different formats. But then how do you really share it in community and share it in a way that people get to test some of the ideas? They get to think about what's being put forward and then connect with others, and sort of integrate into practice ideas. So I'll tell you a bit about how we've done that. And the main way we did this was through a series of community knowledge sharing events, which are also called Wisdom to Action events. We actually called the events Wisdom to Action before we called ourselves Wisdom to Action. And that name was chosen very purposely with the idea that everyone has wisdom to share. And so again, our aim with these events was to develop, cross-sectoral, interdisciplinary, youth-engaged spaces. We did that in a number of ways. So we always had a participatory planning team who helped us develop the purpose for the event and guide in terms of everything from where is the best location to have this event in this community to really helping us with a sort of a snowball invitation approach to make sure that we were really, reaching into community. And I think that was really important for community service providers in particular, because they were hearing from their peers that maybe what was happening was a little bit different than the average conference. So if they're thinking about the pressures on their own time and resources, they would, maybe be able to see if this event might make sense for them. In terms of different types of learning, so most of the days are spent in small group discussions, and we move people through, sort of a series of discussions that help provide a lot of information. So we often replace, for instance, a typical panel discussion with a World Cafe sort of style. And instead of a concurrent session approach, we use something called open space, where actually people build that part of the agenda together in the room, and offer to host conversations on questions they may have, or projects they may want to share, or project questions they have. And so I'm going to run through a couple more slides and then show you a video, because I really think the best way to get a sense of what these look like is to see some videos. So maybe I'll go through the next slide. So in February 2018, we hosted an event in Vancouver, Canada called Embrace Life. And this was focused on youth-led suicide prevention. So just to back up, we had a youth advisory council as part of Wisdom to Action. And on our youth advisory council, we had a number of members who were working in suicide prevention. And they were really interested in finding a way for our network to do some work around that issue. At the same time, in Canada, there's a lot of work happening in suicide prevention. So we did spend some time thinking about what's our sort of added value. And that's where we, with our commitment to youth engagement, felt that looking at how young people are engaged in this issue would be really consistent and also not happening in other spaces. So again, we had a participatory planning team that included youth and service providers, government officials, healthcare professionals, and researchers. We did a literature review that again looked at the research evidence, but also we spent a lot of time deep diving into the gray literature and identified over 50 examples of programs that were really sort of youth-led or youth-engaged suicide prevention. So that was gathering the knowledge. And then we had our community knowledge sharing event. The group that you see pictured there is most of our youth team. So our Wisdom to Action model includes developing a youth team who actually really leads the design of the day. And then we offer training and support for the youth team to host the event. And so this was a really diverse group. As you can see, high school, undergraduate, and graduate students, some service providers, young people who had started programs in this area while they were students or were living in their community. They had a lot of experience in Indigenous communities. We had First Nations and Inuit youth who were part of this host team, and a lot of young people with lived experience of mental health or of surviving suicide or connected through their community. So we're a national group, and Canada's a big country, as you know, so we were connecting online prior to the event to do that design and start capacity building. We spent the day together before the event started as a youth planning day, And really interestingly, they developed, we had mental health support and elders on site for the event, but they developed their own peer support model as well that they wanted to roll out. So I'll run through the slide and then we can watch the video. So we, because we'd done that knowledge, a literature review, we had talked to a lot of our participants prior to the event. So we really went in with some ideas of key themes of what works in terms of youth-led suicide prevention. And at the event and following the event, we developed actually a prototype for a youth-engaged suicide prevention model for rural and remote First Nations communities. So I will say that we have we've worked together collaboratively for a couple of funding applications. We're not quite there yet, but I think, to think about how we can take what we're learning and facilitate its uptake in community, developing actually a project model and trying to support communities to find funding seemed to be a really important step. So now I'll ask if the video can be shown. And so this is the youth host talking about their day.
Hi, my name is Dana Turdy, and I'm part of the youth host team for the Wisdom to Action Embrace Life event in Vancouver. So during this event, the focus was on youth-led suicide prevention and how we approach that. And we gathered for 2 days on the unceded territory of the Coast Salish people, and we are very grateful to do that on these territories and to have First Nation communities and Indigenous youth come from all across Canada and from the north. So we also had frontline support workers. We have people from the Ministry of Education. It's been really amazing, and it's awesome to see a collaborative effort from everyone and from such diverse backgrounds and communities. So our objectives were essentially to share promising practices in youth-led suicide prevention, and we connected and felt support and built relationships with each other. And we did this through activities such as open space, where essentially the participators get to choose what they want to talk about, and anyone can join a conversation, and fishbowl, where you get to observe a conversation in the middle of the big circle and just listen and feel heard. Also World Cafe, where there are small groups exploring questions that were predetermined. It's having conversations about those kind of questions, as well as through presentations from all different kinds of organizations. So we had jack.org, and we had the Red Cross give a presentation. So Michael Kuskak talked about his experience as a children's author with Indigenous topics, and also the Urban Native Youth Association, who danced and sang and played music for us. So yeah, it was just an amazing event to be part of.
Great. So thanks for sharing that. And I should say, I couldn't remember if Dana talked about the fact. So those presentations were actually Pechakucha presentations. And so, linking back to John's presentation earlier, that is a format that we have often used in events, and have found it to work really well. I will say as well, we have sometimes sort of taken that format and worked a little bit with it. And I mean, I sometimes worry when people take a facilitation approach and kind of, adjust it or riff off of it, and just making sure that you actually get to the outcomes that you wanted. But one of the things that we have heard from young people with anxiety actually is that Pechakucha can sometimes be really difficult because of the pressure and the slides are changing. At the same time, it's always been really interesting to work with researchers to develop them. So, if you go on our website on the events section, you'll see a lot of our events listed there. And we did an event called From Trauma to Resilience, and that was building on a research project on preventing sexual violence, with a particular focus on young men. And so that really sort of was an event that sort of grew from researchers, community-engaged researchers, but researchers nonetheless, and then became a community event. And so working with researchers to develop Pechacuchas, often sometimes there is some concern or even perhaps resistance in terms of trying to boil things down to the 6 minutes and 40 seconds and to not be using slides with words and that sort of thing. I will say that consistently the feedback from researchers has been that they actually really enjoyed the format, that they really felt that they were able to get everything across that they want to get across. And I think and then often they also get feedback at the event from folks who listened to their presentation, and then were able to reflect back what they had heard and said. So that is a format that we have used before. And so I should say that we've done lots and lots of evaluations. So one of the things that we do is we support people to do evaluations, organizations to develop their evaluation skills. So we ourselves have done a number of evaluations, and we've done a lot of Wisdom to Action events evaluations. So we do an immediate post-event one, or sort of at the event, and I should have included a photo. We often use even a very visual evaluation, and I can send this along to the conference organizers to post in the resource center. And then sometimes we do the more traditional evaluation, and really what we want to know is thinking through how we measured knowledge translation impact. So at this point, immediate post-event, do you feel are you reporting increased knowledge or increased connections or new connections? And then we also ask people to reflect on the youth engagement component and the facilitation methods. And then for our first few years, we've followed up with a 6 and 12-month evaluation. And there we really wanted to see, did you take that new knowledge and make a change? Those new connections, did that result in a policy or program change? So we looked for stories around service partnership and change. We regularly had organizations come to an event in their own community and not know about each other and realize that they were serving the same groups of young people and were probably overlapping in some way, shape, or form. We've had organizations learn about new frameworks that they've adopted. And then there's also been new academic partnerships. So whether that's researchers and community-based organizations being able to partner together, or we've also connected graduate students with more established researchers to form partnerships. And so that final, if you recall, I talked about the Paris model. So gathering the evidence, contextualizing the evidence, and then thinking about how to facilitate the uptake of evidence. And I will say, I think this piece is really important because, often when people consult with us around knowledge mobilization or knowledge translation, they talk about great ideas like, building a website or a toolkit. And my concern always with things like that is, in knowledge translation, you can build it and you can put it online, and particularly in community service providers, they can download it, and still the barriers remain in terms of time and resources and networks to actually use what you're offering. And so, with that in mind, I offered the example of the K&B Innovation Fund, the micro grants earlier, and through that, what we started to realize too is that what people also needed was support and sort of coaching or mentoring. And so we launched a knowledge mobilization and evaluation mentoring program that ran for 3 years, from 2016 to 2019. We built this through a number of steps. So first of all, for our second round of funding, we actually had a regional hub structure. So we had folks from the Center of Excellence in Child and Youth Mental Health in Ottawa, Ontario, the Centre de Liaison et Prévention Psychosociale, or CLIP, in Montreal, and we also had the Kajaudet Health Research Center in Iqaluit, Nunavut, join us as our regional hubs. And they were able to bring a lot of experience in community coaching and mentorship like we wanted to do. So they were well experienced in working with communities, organizations to help them implement a new practice or learn more about evaluation or about knowledge mobilization. So together we did build a toolkit, but we didn't just leave it there. So we built the toolkit, And then this is where the mentoring program came in. We wanted to help people learn how to use what was in the toolkit. So we had an application process whereby community organizations could review the toolkit and identify where they wanted to increase their knowledge mobilization or evaluation capacity. And then we worked together over the course of a year. So we had a 1-year work plan. We had 100 hours of mentoring for folks. And it was a really important process. We have evaluated that initiative, and people have reported, really positive outcomes from that. So maybe I can go to the next slide, because I think that gets to some of the evaluation. And I think these are really important learnings for thinking about doing community-based knowledge mobilization. So, and this was interesting because we chose the word mentoring as opposed to coaching, because we felt it really reflected the co-learning that we wanted to achieve. And while it was an organizational mentoring program, we still saw that relationships were super important. So the relationships between the people in the mentoring relationship as well as the organizations. We know that it was super important to have a strong understanding of context and also have a responsive and adaptive work planning approach. So thinking about community-based organizations and some of the barriers and facilitators that I identified earlier, things change and priorities change. Funding changes for community-based organizations. Their needs of their clients shape what people want to be working on. And so while we established those work plans, we found that we really had to be constantly reassessing them and updating them as the year went on. Certainly there was a temptation to, and sometimes almost a demand from our partners to sort of move from mentoring into doing or managing. And so that was really important to be aware of that and to think about, it was often a fine balance in terms of walking alongside organizations or knowing what piece of work was important to undertake. And then I guess the other challenge was just staying connected. So again, thinking about some of the barriers to knowledge mobilization for community service providers, how can we best support organizations when they're providing critical services for young people and often facing, client crises, funding crises, and how to best stay connected. And I just wanted to say, it's sort of, I think I'm ending off my presentation talking a bit about our commitment to youth engagement and why we felt that was really important. So we did all of our work from a youth engaged perspective. So young people were on our board. We had a youth advisory committee. And I think probably, as I've alluded to, as I've talked through our various projects and programs, young people were involved every step of the way. And I should say, actually, going back to the mentoring program, the number of our projects were on youth engagement, and we had youth lead or support a number of those mentoring relationships as well. And so, especially since we were doing a lot of training and supporting organizations around youth engagement, we thought it was really important to do our own evaluation of our practice. And so we undertook a participatory evaluation of our youth advisory function. And so, I think you can see there the quote that every engagement that works best is one where everyone, including adults and professionals, feel like they have gained from the experience. Young people reported that they were interested in becoming involved with a knowledge mobilization network, for instance, because it gave them a chance to address sectoral level issues. So it's a chance to move beyond going from service to service and doing advocacy to actually recommending changes at a systems level. And our youth advisors position themselves in sort of 3 different ways. So one, as you can see, collaborators and partners. So they're often involved in lots of different projects in the youth serving sector and in the youth mental health sector. Most of them saw themselves as moving into the mental health sector as professionals. So they saw themselves in that role. And they also continued to see themselves as youth. And so they were youth with mostly with lived experience of the youth serving sector. And so we reported that the benefits are mutual. And they also reported that while they could understand their impact on the organization and they could see their impact in various different projects, that what they really needed to understand more of was at the sectoral level. And I think that's often a challenge when thinking about evaluating knowledge translation in general, is keeping track of those bigger systems changes. Okay, next slide, please. And so they developed a theory of change. So stronger youth advisors results in a stronger youth serving sector that improves youth well-being. And this seems, I really loved this perspective, and had seen over 6 years how that was being implemented. So I think overall, in terms of the network, I think we really saw that by taking an approach that valued the academic and practice-based evidence, it really shook up some of that language that's often used in knowledge translation around there being knowledge producers, which are usually thought of as the researchers, and knowledge users, which are usually thought of as government services and people using programs or services. So in this case, youth themselves, and started to move people around. And so if we were thinking about what strengthening the practice-based evidence by using more evaluation, that could turn service users into knowledge producers. By valuing the lived experience, again, that took youth and put them in the role of knowledge producers. When we welcomed researchers to our Wisdom to Action events and said that, most of the time we didn't do a lot of presentations, so please come because of your interest and expertise in this area, but participating as equal partners in small group discussions. And I think there's a lot of value in those shifting roles. I think that we had an approach to knowledge mobilization that tried to account for the common internal and external barriers of community-based organizations, and we had an approach that was really quite responsive in ourselves in terms of growing and developing our practice based on evaluation, based on what we saw happening elsewhere in the sector, and really integrating youth voice in terms of our approach in our projects. I really do think principles matter. Whether it's working on a report or an event, being clear about your organizational principles is super helpful. So for us, having a clear commitment, for instance, to youth engagement really shaped who we partnered with and how we did the work that we did. And obviously the need to plan for and fund evaluation. And in our case, we were lucky to have funding that allowed us to do that. And I think in knowledge mobilization it's really important because we could keep producing the same products, we could keep trying to reach the same stakeholders, but unless we know if it's working, we don't know if we're having an impact. Or the next slide, sorry, which is the next steps. So as I noted, we were funded by the Canadian government for our first few years of operation. And then as an organization, we actually incorporated as a social enterprise in February 2018. And what that means is we do offer services for a fee to organizations that are able to provide that funding. But we also work with organizations who aren't able to access evaluations or other types of evidence support. And so this year, we've been working closely with a Halifax-based organization called Family SOS and supporting them in evaluation and curriculum development. So we were, those are our services, remain committed to community impact. You can reach me at that email, and our website has tons of information on it. Like I said, the events page You can go there and look at some of our event reports on a range of issues and in different communities, as well as videos. And we also do have a YouTube channel. And on the YouTube channel, we have some examples actually of our Pecha Kucha presentations if you want to go have a look at them. Thanks, and now we can turn to questions.
Wonderful. Well, thank you so much, Lisa. And you can go ahead and turn on your video now so everyone can see you. And we're going to be joined again by Jess Chaikin and Lauren Pulvery. I don't see Lauren. Hang on. Okay, there you are. Hey. Okay, so just this is a tiny point of clarification, Lisa, and it's kind of a boring way to start the discussion, but before I forget, is there a difference between a social enterprise and what we would call in the US a nonprofit, or other countries call civil society, or a community-based organization? Is that something specific?
There is a difference. So we aren't incorporated as a nonprofit, so basically there's different legislation in different parts of Canada to sort of continue the not exciting way to start the question period. But I mean, essentially you incorporate as a business, but then have a commitment to, contributing to different areas of community development. In our case, it's working with organizations who couldn't otherwise access our services.
Okay, thanks. I was just curious, because it is interesting from the perspective of, where is there going to be evidence pushed out, or knowledge translation, knowledge mobilization activity happening, and we tend to think it's at organizations like American Institutes for research or university-based centers, but obviously there is an important role that other entities or people such as yourselves can set up as individuals. And I did also, just kind of a housekeeping point of clarification, we have a very efficient staff here at KTDRR who put together this conference, and as all the presenters know, we require that they submit things fairly early, and life does happen. So Lisa is no longer with Kids in Pain. So
Thanks.
just as a correction to my introduction of them. Okay, so on to things that are a little juicier.
Awesome.
Jess Chaikin, you mentioned, well, you can talk about your own comment, right, about diverse participation.
Sure. Yeah, I noticed you certainly pointed out just how diverse your groups were that participated in all of these different events. How do you facilitate the conversations within those groups without letting sort of the dominant group center the conversation on themselves? How do you keep the voices from those underrepresented groups floating to the top of the conversation? You mentioned how some of the participants, when in their evaluation, they reported they really felt heard, and you saw that in the interactions. So how do you keep the conversations going without letting those of us who think we know better take over the conversations?
So I think it starts from really from the get-go. So I mentioned that we always have a participatory planning team around our events in particular, and I can start with that as an example. And so from the very beginning, we're inviting people to a conversation about a project or an event, and that includes the researchers, the government officials, the service providers, and the young people. And so that sort of creates the groundwork for a team of people who are involved, who understand the principles behind the work and confirm the objectives. So part of it's like, confirming the purpose of the event or project. And then that really kind of gets reflected out sort of throughout how we communicate. So in terms of events, we always send out a welcome letter in advance that tries to start identifying sort of what people can expect, because often people have referred to our approach as sort of an unconference, which I don't actually think it totally is, but we often don't send out event agendas, for instance. So we really need to prep people for what they're walking into, and we talk about the youth team and that sort of thing. And then especially having youth teams who lead the events, I think that really starts to center diverse voice. And so, you know, an ideal event is often that I'm not doing a lot of active facilitation. I'm there, I can provide support. We've also developed a model where we often have youth who have a vast range of experience in engagement and facilitation who actually support the youth team. So I'm even like one step further removed as sort of the adult in the room. And so I think all of that helps to sort of set the stage. Like we're not just saying we want youth engaged, like we're walking the walk. And then, you know, I talked about the idea that we have these principles and that they really matter. And so actually, even within our events, each section, each sort of activity, so whether it's an opening circle or the World Cafe or open space I mentioned, actually has its own principles. And we actually get really quite explicit and kind of say, so if you're doing a World Cafe and there's 5 people, then everybody should be speaking kind of 1/5 of the time. And to really look at how you can make connections and integrate information is really important. So I think that's how we do it, is that we really demonstrate out in all of our communications what we're trying to do, and then really try and make that comfortable in the room for everyone who's attending. And I mean, and you know, and it's actually a very reflective process in terms of you know, with the youth host teams and within our organization, like did we really feel that everyone felt like they were able to participate? What were we seeing, and you know, what would we do differently the next time? But I could talk about this all day, actually, so I'll stop there.
So, Jess, we're going to turn the tables a little bit on, you know, kind of pose a version of that question to you, right? Your job is to stay connected to all, you know, 300 odd grantees of our funding agency, NIDLR. So I'm sure there are, and I think probably KTDRR is one of them, you know, frequent flyers who are always like, me, I want to be in the newsletter. So how do you stay connected with all of the grantees who may not be so vocal?
We do a lot of stalking, to put it mildly, tracking the grantees, their social media output, their publication output. We through indexes, tables of contents, but we have several touch points throughout the year where we're actually reaching out to the principal investigators and their staff to remind them that we're here and what we do, and to get updates on their latest activities, get our hands on actual publications. And then we also have points throughout the year where we're producing materials where we go back to the grantees and engage them. We're working on this topic. What do you have? What are you doing in this area? We summarize the research that they're doing, and we will go back to them and have them review the summaries, work with us to make sure they're accurate and engaging. And then once the product is finished, give it back to them and they can distribute it to their own networks. So there's a bunch of ways that we try to stay engaged. The NARTEC conference is one of the best examples of that, just sitting across the table from the grantees, from other grantees, and talking and exchanging ideas.
Yeah, I mean, as much as we love our online conference, it's nice to have face-to-face interactions as well. So Lauren, I'm thinking about you and the people that you've been super engaged with. It's one thing, you know, to want to draw out the kind of shy or reticent person, and it's another thing when the story that is important to hear is actually traumatic to tell. So how do you sort of deal with equity in the fostering conversation and that issue?
That's a really good question. I would say that for something like that, I think it's really important to think about setting the stage for that in any conversations that are going to be held, just talking about content and what could be raised, and just giving a sense for people to think about what's comfortable to share, what they want to share, but also ways that they could maybe exit components of that might not be comfortable for them. I think consistent with Lisa's presentation, it's another point in which you could engage youth is actually setting those kinds of parameters and setting parameters around you, how you can discuss those issues. Because I think sometimes the messaging coming from young people themselves is more powerful than the message of like a researcher, for example, setting the stage for those kinds of parameters. So I think it's yet another point to see if we could have, you know, members of something like Lisa said, a participatory planning team weighing in about things like that as well.
And if I can just hop in, I mean, we definitely think a lot about sort of safety and how to support people. And, you know, a few steps that we take. So I mentioned the letter that goes out. We also speak to this point sort of very early on in the process about the fact that, you know, it's while we're talking about incredibly sensitive and difficult topics, that the focus really is on services and research questions rather than having a therapeutic space. At the same time, we always work with elders of the local community. So usually First Nations and Inuit elders who help us open properly and doing the land acknowledgement, but also stay for the day. And we always have sort of professional mental health support. So and so those folks sort of pop up at the beginning and let people know who they are, who can do sort of a debrief with people as well. And you know, and then we always look for a space, I should say, you know, and sort of part of, you know, attracting diverse participants is also kind of considering space and location. So we work very hard to be in community spaces that feel accessible to people. So we actively try and avoid universities and hotels, for instance, and so that, you know, that helps. But we often look for a space that also has a quiet space. So we'll have our big room where we're doing all of the moving and discussing, and then have at least one quiet space set up where people can go and sort of chill out. And I think the other thing that we do is that there is often a lot of talking at a participatory conference, but because we always have a lot of visuals happening, we usually work with a graphic facilitator, and there's a lot of harvesting, so people can kind of also take their breaks or express themselves in ways other than speaking.
I've never really thought about that, the importance of other modes of expression, although that's partly what today is all about. So I think all of what we're talking about, it's pretty hard to know when we're doing it well, particularly if there's a lack of self-awareness on the part of the organizers. So that points to the importance of evaluation that Terry Donovan was bringing up earlier in the conference. Terry, do you want to elaborate a little bit on how your center tries to evaluate the knowledge translation you do, whether or not you're specifically evaluating stakeholder engagement?
Sure. I'd mentioned in the chat, you know, we, like many places, do a considerable amount of training and often have the evaluation right after the training. We began to realize that's all well and good, but is anybody using any of this at all after we invest all this time, effort, et cetera? So we've more in about the last 6 months or so, we've started doing follow-up surveys at 3, 6, and 9 months, asking participants, and we'll break the training into modules if possible, or sort of manageable, sort of asking, are you using this? Are you not using it? And maybe a couple of open-ended questions. Is there a reason you're not using it? I can't tell you much because our response rate is not great, so we need to work on that. But it is a piece that we think we need to keep doing, although it can be a little unnerving when you hear back that, no, I'm not using it, you know. But that's a piece we've started, so both in the initial evaluation, but after the fact. And some of that, I think, will begin helping us, perhaps even tailoring the original training piece in ways, and I think it goes to a lot of the presentation here so far about how do we connect people to the information in ways that they really want to use it, more than just giving it to them like a PowerPoint slide. So there's some pieces from today, others have talked about it, that with luck we can implement in the ways we're doing things.
Mm-hmm. And if I might just add too, I mean, when we do the follow-up evaluations, we definitely see a decrease in the response rate, like radically. So I always sort of assume that means people, that's who has a story they want to share, and sort of accept that. Obviously, we do lots of like incentives, so offering travel funding to our next event, like what have you, to try and get people to fill out the evaluation survey and try and make them as painless as possible. Yeah, so but I definitely get your point that, and I have had, when there has been an incentive, people felt like sharing their response, and I have had a couple of people like, well, actually I don't know if I'm using it yet, but I wanted to enter the draw for the for the next event. I think if they want to come back, like that's an okay outcome as well. But mostly, I sort of think we get like 10% of the initial responses by the end of the year, and those are usually some pretty good stories.
Thanks, Lisa. So we try in this conference to have it be a real mix of, ooh, fun, let's look at this innovative strategy, and, sort of demonstrations, but also how would you implement that? How do you evaluate it? But in addition to those more pragmatic concerns, we also try to think about theories of knowledge translation. So you did mention, Lisa, that you used the parish model. I know Joanne wrote out the acronym for what that is. And we had asked Lauren to think a little bit about how how she contextualizes knowledge through online and in-person events and the peer support model. Is it similar or different?
Sure. So I actually saw a lot of points of similarity, Lisa, as you were sharing information about your process and what you have been working on. And I think the participatory planning teams was really something that resonated with me. That's worked well in a lot of the projects I've been involved in, just really ensuring that there's strong stakeholder engagement, youth engagement right up front. So it's something that's being co-constructed, not just pushing knowledge out, but really trying to co-construct and co-develop information and co-develop a process as well. I also was thinking about some applications to my work when you discussed a toolkit and how that was a mechanism for sort of continuing this work and also pushing that information to people who could use it, and monitoring and evaluating that as well in order to really see what's working well, what people were finding resonated with them. So I think that's something I've done as well that has been very helpful. I think, for me, listening to your presentation and just seeing that in the slides, the size of the groups and everything, I think the level of stakeholder engagement that you did and facilitation with those groups was really something to see that could really have tremendous promise. One thing that was occurring to me is just when you develop groups of that size coming together, it could be really challenging from a facilitation perspective in terms of seeing how that comes together and how we could do that efficiently, but also that must have been a setting where you could really energize people about that work. So the youth who are working with their communities, just really seeing what the uptake possibilities could look like, and just the fact that other people in different communities are engaged in the same sort of thing. So that was something that I think I'll take with me, is just thinking about, bringing something to scale in that sort of a way. So if I could actually throw that back to you, I was curious about just looking at the size of some of those meetings, what you found kind of challenging from a facilitation perspective, and also if you saw any youth leaders really emerging from that. Because another component I was thinking about with that is, I know you really, it sounds like you really took pains to make sure that it was a youth guided approach, but I could also see potential in terms of kind of moving toward a youth led approach where youth leaders could really emerge in that type of a setting and then bring the ball forward even more. So I'd love to hear about just how that transpired.